One of the most difficult experience for practitioners is working with someone who has been seeking healing for years and sometimes decades. They have read the books, they've attended workshops, they have worked with therapists, they have explored coaching, they have gained insight into their childhood, their relationships, and their emotional patterns. And yet, something still feels stuck. And they may say things like, I understand everything intellectually. I've done so much work on myself. I just can't seem to move past this. And for practitioners, this can raise an important question. Why do some clients remain stuck even after years of sincere effort toward healing? Today, we're going to explore a perspective that is becoming increasingly important in modern healing work, and that is the role of the nervous system in maintaining emotional patterns, even when the mind has already moved forward. If you are new to this channel, my name is Tina Brigittini. I am the founder of Brigittini Energy School, and this is where practitioners learn nervous system regulation, hypnosis, energy therapy, and coherence based coaching. Much of my work focuses on helping practitioners understand how emotional experiences live not only in memory, but also in the body's nervous system patterns. Because when the nervous system becomes organized around survival responses, insight alone may not be enough to create change. The body must also experience regulation and coherence. And this is where many practitioners begin to see powerful shifts in their clients. One of the most important distinctions practitioners can make is the difference between understanding and integration. See, understanding happens in the mind. It involves awareness, reflection, analysis, and the ability to make sense of past experiences. Integration, however, happens within the nervous system. It occurs when the body no longer responds to a memory as though the event is still happening. The experience has been processed. The emotional charge has softened, and the body can return to a state of balance. When integration occurs, something remarkable happens. Clients may still remember the event, but the emotional intensity is no longer overwhelming. They can talk about the experience without actually reliving it. And this is a sign that the nervous system has reorganized around the memory. Now, for some clients, the nervous system has spent years operating in patterns of hypervigilance, anxiety, grief, or emotional protection. And these patterns become familiar. They become the body's normal way of responding to life, even when the client consciously wants to move forward. The nervous system may still be operating from the old survival responses, and this can manifest in several ways. The client may feel constantly on edge. They may experience emotional numbness. They may struggle with chronic worry, or they may repeatedly find themselves in similar relationship dynamics. And these patterns are not simply habits of thought, they are patterns within the body's regulation system. And until that system begins experiencing coherence, the patterns may continue. Now, one of the most overlooked aspects in healing is the role of physiological safety. So, for the nervous system to reorganize, it must first experience safety, not just intellectually, but physically within the body. When the nervous system perceives safety, breathing becomes deeper, heart rate begins stabilizing, muscle tension decreases, and the brain shifts away from constant threat monitoring. And this creates internal conditions that are necessary for integration. But if the nervous system continues to perceive danger, even in subtle ways, the body may remain stuck in survival responses. And this is why practices that support regulation are so valuable in healing work. They help the nervous system to recognize that the present moment is different from the past. Now, another factor that goes unrecognized is the role of the practitioner's own nervous system. Humans are wired for co regulation. Our nervous systems influence one another constantly. So, when a practitioner is calm, grounded, and regulated, clients often begin feeling safer without fully understanding why. Their breathing may slow, their emotional intensity may decrease. Their body begins sensing stability. And this is one of the most powerful aspects of healing work. It is not only what we say or do, it is the state that we bring into the room. Practitioners who cultivate their own nervous system coherence often create a healing environment simply through their presence. Now, if you are someone who works closely with clients, I would be curious to hear your experience. Have you noticed situations where clients understand their patterns intellectually, but still struggle to create lasting change? What have you observed in those situations? Feel free to share your insights in the comments. These conversations are valuable because practitioners often learn just as much from one another's experiences as they do from formal training. And hearing how others navigate these challenges can be incredibly helpful. Now, when practitioners begin understanding the nervous system's role in emotional patterns, something important changes. We stop asking, why can't this person move forward? And we begin asking, what does the nervous system need in order to feel safe enough to change? This question leads us toward more compassionate and effective approaches. It reminds us that healing is not simply about insight, it is about supporting the body's natural ability to return to balance. Across many healing professions today, there is a growing recognition that emotional health cannot be separated from nervous system regulation. Practitioners are beginning to integrate breath work, hypnosis, somatic awareness, and energy based practices alongside traditional methods. Not because older approaches were wrong, but because we are expanding our understanding of how healing actually occurs. And when we begin supporting both the mind and the nervous system, and this is the mind body connection, the results can be profound. Now, if there's one insight I would like you to take away from today's conversation, is this: clients are not always stuck because they lack understanding. Many times they're stuck because their nervous system has not yet experienced the conditions necessary for integration. And when we begin working with the nervous system directly, the path to its healing becomes much clearer. Now, if you're a practitioner interested in exploring these approaches more deeply, you can learn more about the programs and certifications available through Brigitini Energy School. I will place the link down below so that you can explore the trainings that may support your work with your clients. If you're enjoying this series on nervous system coherence for practitioners, make sure to subscribe to the Aligned Healer channel so that you don't miss the next video. Because next, we're going to explore a topic that is not always discussed in practitioner training, and that's the role of co-regulation between practitioner and client, and how the nervous systems in a healing space influence one another. I look forward to continuing this conversation with you. Many blessings to you, Tina Brigitini.